This will be a short update today. And as I was walking in here, I thought, I wonder if people are getting tired of these updates and tired of hearing the information. But yet I think it is still important that we do give you updates and make sure that people are informed about what's going on here in Prince Edward Island. And as long as people are not tired of it, we'll continue. Sometimes I'm worried I'm going to get tired myself of trying to figure out what to wear. But I do think it's really important that we continue to message out during this time, and I hope you agree. Around the world, there are close to 2 million cases of COVID-19 and 128,000 deaths. Across Canada, there have been over 27,000 cases and 903 deaths. Our case fatality rate in the country is 3.1%. 5% of the cases have been in young people less than 19 years of age. Today, I am confirming a new positive case for Prince Edward Island, bringing our total number of confirmed positive cases to 26, of which 23 are recovered. The new case is a male in his 30s from Queens County, an essential worker not providing public-facing service, returning from international travel. I spoke to him this morning. He is at home, and his close contacts are being tested this afternoon. He has not been back to work since his return to the province. We also received an additional 92 negative test results since yesterday, and P.E.I. has done more than 2,000 tests. Yesterday, I spoke about Prince Edward Island's model-based projections, which show what outcomes could look like with different public health interventions in place. Models are not perfect, and they do not tell the future. However, they do paint a picture of what could be, and helping to inform planning and support decision-making. The large majority of Islanders have been doing a tremendous job following the public health measures we have put in place. And these models show what P.E.I. might look like if these measures were not in place or were not being followed. While this is not the finish line, it is a sign that we are on the right track. So this is good news. It means our actions have made a difference, but we need to keep going. Our public health measures must continue, staying home as much as possible, physical distancing, self-isolation following travel outside the province. If Islanders continue to adhere to public health advice, we may be able to look towards a time when an ease-back plan can be implemented. And when it is time for this, it will be a delicate balance between modifying the measures and ensuring we will not overwhelm our healthcare system. However, it is not time to ease back yet, so we need to keep going. Some of you may have heard the Director General of the WHO, who gave advice last night to countries about what needs to be in place before easing up and reopening. And I think we need to look at some of those measures even as a province as we think about our easing up of these measures. I got home in time last night to put my children to bed, and they asked me the questions they often do. When can we see our friends? When can we start to do things? We used to do things, Mama. When can we start to do them again? When can we hug Gran? And aren't these the questions we're all asking? I wish I had answers for my children, and I wish I had answers to these questions for all Islanders. While I know we've been very fortunate to have had so few cases, my concern is always that Islanders will become complacent and we can ease up too quickly on the measures we've put in place. I do feel we need to stay the course, and this is difficult for everyone, but we should be really proud of what we have accomplished so far. I am proud of Islanders. And each day we comply with these measures and adhere to them, is one day closer to living and working together more closely. Thank you. Aujourd'hui, autour du monde, nous voyons l'impact de COVID-19. Plus de 2 millions de cas et plus de 128 000 morts. À travers notre pays, il y a plus de 27 000 cas et plus de 900 morts. Il y a un nouveau cas ici à l'île du Prince-Édouard aujourd'hui. Notre total est rendu à 26 et 23 sont rétablis. Je confirme également que nous avons reçu 92 résultats négatifs. C'est un homme dans ses trentaines de la comté de Queens. C'est un travailleur essentiel qui est revenu d'un voyage à l'étranger. Hier, j'ai discuté les projections pour notre province et ce qui aurait pu être notre situation si nous n'avions pas pris les mesures actuelles. Les modèles ne sont pas parfaits. Ce n'est pas une indication claire de l'avenir. C'est un portrait de ce qui est possible. C'est pour nous aider avec la planification et pour prendre les décisions. À tous les insulaires qui respectent les consignes, bravo et merci. Vous le faites avec brio. Selon le modèle, je vous ai montré ce qui pourrait être notre avenir si nous ne respectons pas les consignes. On n'est pas encore sorti de l'auberge, mais nous sommes sur la bonne voie. Je veux être claire, les actions que nous faisons aujourd'hui font toute la différence et c'est une bonne nouvelle chaque jour que je vous annonce que nous n'avons pas beaucoup de cas. Mais nous sommes loin d'arriver à la fin. On doit continuer à faire ce qui est nécessaire, rester chez nous, pratiquer la distance physique, l'isolement aux besoins quand vous venez de l'extérieur de la province. Si tout le monde continue à respecter les consignes, nous pourrions envisager un relâchement éventuel. C'est très délicat, il va falloir trouver un juste équilibre entre modifier les consignes et gérer les besoins de notre système de santé. Mais je vous confirme que ce n'est pas le temps de parler de relâchement en tout cas. Concentrons-nous sur les mesures pour protéger la santé et la sécurité de nos gens. On doit continuer. Ne cherchez pas des façons d'échapper aux consignes. Soyons fiers de ce que nous avons accompli. Je sais que je suis fière de tous les insulaires. Je sais que c'est dur pour tout le monde. Si on continue à bien faire notre job, on serait en mesure de retourner à la norme plus rapidement. Merci.